Hi everyone, this is Simon from the School of Nursing and Health Study of the Open University of Hong Kong. Thanks for the invitations from the organizing committee of this symposiums for giving me this opportunity to share with you here today. It's my pleasure for me to give this talk, which allows me to share some updates on our school development on technological education. Unfortunately, we cannot have face-to-face meeting in the symposium this time, and we can only have very limited interactions with you through this video. More importantly, we cannot give you some of the demonstrations or guided tour on campus this time, but I'm sure you can still get some updates from this talk on how our school applying technological education into our nursing curriculum. Let me give you some background for myself. My expertise is focusing on teaching anatomy and physiology. So, my talk today will be focusing on technological advancement in anatomy and physiology educations. I'm going to illustrate my point by how we advanced from conventional cadaver dissections, an essential way for learning anatomy in the past and present for health-related discipline, into digital learning era that's happening nowadays. I hope you will enjoy my sharing. Here is the outline for my talk. I will mainly go through these 4 areas with you today. First of all, I will give you some backgrounds on how importance of A&P in nursing and other health-related studies, and then I will introduce to you how is the conventional way for students to learn anatomy. Next, I will give you some information on what technology we have, why we need to add in these technological elements into the A&P teachings, and how these technologies help student learning A&P. The final part, I will focus on the road ahead for A&P teaching and learning. I will try to give you some ideas on how we can further improve our teaching and learning of A&P by applying more technological elements that we have to further enhance student learning experience. Let's get started. Anatomy and physiology is a very important subject for all health-related studies. Every student in nursing or health-related study needs to understand what is the structure of our body and how the human body works. This is the fundamental, or you can say the foundation for their studies, and usually it will be a core course for the preclinical training phase in nearly all health-related disciplines, including nursing. For us, A&P is the very first course that every nursing student must have once they have entering our program, no matter they are at bachelor level or at sub-degree level. I will say this is not an easy course for them. You can imagine how complicated that so many systems works together to make your body works normally. They have lots of information to learn and lots of complicated concepts to understand. Of course, we need to cover all body system in terms of both structure, that's what we call anatomy, and how it works, that's what we call physiology. In a more complicated way, how the structure of a specific organs contribute or facilitate its functions. That's why we always put anatomy and physiology together. Use our heart as an example. Why the heart has 4 chambers and the left and right side of the heart are completely separated? It is because we need to make sure our blood contain different oxygen level are separated, and this is essential to make sure every part of our body can get sufficient oxygen supply. I'm sure you will have problem if the blood with different oxygen content mixed together before it being pumped out of the heart. So the idea is students have to understand what is normal. They have to understand normal anatomy of the human body. They have to understand how the system works normally. In case your body didn't work normally, you have a disease. And that's why we need nurses and other healthcare personnel to help. I always told my students, I cannot teach you how to be a nurse, but I'm sure you cannot be a nurse if you don't understand how the human body works and what is abnormal in the patient in front of you who need your helping hands. The take-home message here is A&P is an essential foundation courses to prepare them for advanced level learning about various diseases that is abnormal in the human body. So they have to understand normal well before they are going to understand abnormal. Let's have a look on how we learned anatomy in the past. The most easily available media until nowadays is still books, pictures, photos, and videos. All these media can give a 2D image of the structure and organs. But I should remind you all that the structure of the human body is a 3-dimensional structure. By just using these media, students cannot observe the 3D structure of the organs. The only way to understand human body in 3D structure is by dissection of the cadaver. It has a very long history for using cadaveric dissection since the 3rd century. It is still the mainstream method for learning anatomy until today, but of course, it has a lot of limitations and drawbacks for using cadaveric dissections. Now we can move on to have a look on how various technologies can help in the teaching and learning of A&P. In the coming few slides, I will go through some technological tools that we are currently using in our school for teaching A&P. They are the 3D technologies, mobile apps, virtual reality, and lastly, the digital dissection. Let us start from 3D technology. 3D technology is widely used in entertainment in the last decade. I'm sure most of you watched a 3D movie before, or even you have a 3D TV at home. However, 3D technology can also be used in surgical robotic system to aid surgeon to perform remote operation. This can allow the surgeon at the remote console to have a 3D visions to perform the operations. By applying the same concept, the 3D technology is a very useful technology to apply in teaching A&P. It is a very good way to display the 3D structure of an organ and a body. So we start using some 3D software to teach A&P since 2015. We also tailor-made some 3D animation in some specific topic to illustrate the difficult physiological concepts. For hardware, we have installed a 3D projector in our lecture theater, which can cater 350 students at a time for 3D lecturing. We also equip our VR education unit with the 3D TV so we can have a small group tutorial sessions there. You can see the picture in the lower panel while we are doing the 3D lecture or tutorial. Students only need to bring in their own 3D glasses and they can see the 3D images, either on the screen or in the TV. This greatly enhances their learning experience and help them to understand the 3D structure rather than just by the 2D video on the web. Another tool that we are using is the mobile apps. If you try to browse App Store or Play Store, you can easily find some apps which provide information on anatomy. The Sensavis visual learning tools and the Visible Body are the apps that we are using since 2018. We will use it during the lecture and it allows our students to revise the A&P content using their own tablet or PC. We provide iPad to all of our Year 1 nursing students to facilitate their learning throughout the program, so they can use these apps to revise the content of A&P anytime, anywhere they like. The PC version of the Sensavis app can also give 3D outputs. We will also use it for teaching during lecture or tutorial sessions with the support of 3D projectors or TV. Our students not only using their iPad for learning A&P, we also provide different apps to facilitate student learning. For example, the iBook case, they can access all course material through this app. Also, our school has videotaped some of the nursing procedures to allow our students to revise how to do certain procedures before they work in the ward. We also use apps to record the student performance in their clinical placement, so we can make full use of the iPad which provide for the student. The next technological elements that we are going to discuss is virtual reality, VR. VR technology has a very fast development in the last few years and many institutions start using VR for education purposes. We start using VR for A&P courses since 2017. The two software that we use is the 3D Organal and the Shared Care VR. For the 3D Organal, it mainly provides the content for anatomy. From a screen cap on the top, you can see the skeletal structure of different parts of the body. Students can walk around the model to see the detailed structure of the human anatomy. The developer also adding in some video content to illustrate different physiological concepts in the human body. This makes this VR software more useful for our teaching. Another software that we use is the Shared Care VR. This software will be more focusing on physiology parts and it has various disease models. Use the screen cap at the lower panel as an example. By using this software, students can easily visualize blood flow in the coronary artery. And then we can switch on the disease mode, say atherosclerosis. You can clearly see the two cholesterol plaques accumulate inside the coronary artery, making the diameter of the vessel become narrower and the blood flow decrease. As the disease continues to progress, the plaque will completely block the coronary artery and eventually causing the coronary heart disease. Students can learn this disease very easily by using the VR software which can control by themselves. They can learn it very interactively using the VR software. Here is a short video demonstration to show you how the software helps student learning. So you can see the control panels. By using this panel, we can explore and select different systems in the human body. Let's choose the heart again. Okay, now we can see the heart is beating. We can see the structure of the hearts, blood vessels, and blood supply. And then we can go inside different chambers of the heart, and we can see those blood flow represented by the blue or red dots inside the heart. We can also see how the heart valve works. And we can see the difference of the heart valve between left and right side of the heart when we switch to the other sides of the hearts. On top of structure, we can also see the electrocardiogram (ECG) of the hearts. We can also look at the heart in more detail at different layers, okay, just like this. We can make the heartbeat faster or slower, and you can see the ECG actually reflects the heartbeat in real time. Okay, now we switch to the disease mode. It presets several heart diseases that we can choose. Just like what I just said, we can choose the severity of the disease, and we will try to show where is the problem arise. Here the problem is coming from a cardiac conduction system, so we can see the abnormal pattern of the ECG below. Okay, let's look at the coronary artery disease. First, we see the normal blood flow in the vessels. As long as we adjust the severity of blockage happens inside the vessels. You can see the cholesterol plaque build up inside the vessels. Eventually, the whole vessel is being blocked by the plaque. Very limited blood can be supplied to the heart muscles. Okay, and then we let the student know how to manage it. We can put a stent inside to keep the vessel open. This is how the stent works. So by using this software, student can learn the structure of the heart, how's the blood flow inside the heart, how's the heart beats, what is ECG, also learn some common heart disease. The take-home message is that VR is a very good tool to visualize and illustrate some difficult concepts of A&P. The last technology that I would like to introduce is the digital dissection system. We started using this system since last year. The two pictures on the left showing you the dissection system, whereas the right panel showing my colleagues doing the teaching using the system. Actually, we can see our students are interested in using the system to learn anatomy as they have hands-on experience on dissections rather than just reading their lecture notes. In the coming few slides, I will quickly go through the key features of the digital dissection system. We have in total 4 cadavers presets in the system. One of the powerful features of this dissection system is we can easily get dissections on different planes by just a few taps on the screen. Just like what we see here in the lower panels, students can do it as many times as they like at different planes and angles. This is something we cannot do it even using a real cadavers. Also, students can easily adjust the cutting plane by just moving along a control bar. They can easily observe the organs inside the chest and then move further down to the hip regions and eventually down to the leg. Although we are not using a real cadavers, but the easy control allows our student to learn anatomy quickly rather than practicing the dissection skill using a real cadavers. Another key feature is the system actually have a very good database for pathophysiology studies and histology studies. The pictures here actually showing the histology mode. Once the students select a specific organs on the cadaver, the histology slide will appear to allow them to study the histology of the particular organs. The example here is the lung. When the student tape on the lung, the microscopic slide of the lung will come out. They can see the lung actually have many air-filled space to allow gaseous exchange to happen. This can help them to understand how the structure of the lung contributes to its functions, which is gaseous exchange. As I just mentioned, the system can allow pathophysiology studies of different diseases. This is another cadaver who has leukemia. One of the common symptoms of leukemia is the splenomegaly, or you can simply say enlarged spleen. So from the scan on the right, you can see that the spleen has similar size as the liver on the left, which is not normal. Students can easily spot the difference, and we can explain the concept behind and why the splenomegaly is one of the symptoms for the patients with leukemia. All these features can arouse student interest to learn anatomy. Also, it can give lots of information to them rather than just understanding the anatomy. They can learn histology and pathophysiology at the meantime as they are doing the dissections. This is what we have at the moment. Then you will ask, what next? Maybe let me share with you some of our plans in the last part of my presentation today. First of all, we will try to add in the augmented reality elements, AR, in the lecture notes to make it more interactive to our students. The picture on top is actually one of our projects funded by the government. We have little money to create an app for health education and a drug reminder for the community. We put in some AR elements into our health education booklets. User can scan the AR target and the short animations will pop up to show the users the proper way for using medications. For example, how to correctly measure a volume of medicine they need to take. When they scan the target on our booklet, the animation can show them the correct way of doing it. So it is much easier for them to learn instead of just reading the information from our booklets. Using the same idea, we will try to upgrade our lecture notes with AR elements in the near futures. On top of using AR, we will also upgrade our VR hardware. We will upgrade to a wireless headset and we will have a virtual classroom software built in. This software can support up to 300 headsets to join in the sessions. By using this software, we can do VR lecturing or use it as in a small group tutorial. We are also creating some software by ourselves with more interactive features for the student to learn A&P. They can learn during the lecture and tutorial. With the support from the senior management of OUHK and our school, we are going to set up the VR Self-Learning Center in the near future. If the student would like to revise during their free time, they can come to our VR Self-Learning Center to get a headset for doing their revisions. We hope all these can further enhance our student learning using these advanced technologies. That's what I would like to share with you today. Last but not least, I would like to acknowledge all these people who work very hard to make all these success. First, the A&P teaching team colleagues, Dr. Sidap Tam and Dr. Ariel Chow. We work very closely for the digital dissection system and developing the VR software. And then the VR team led by Dr. Kafai Wong, especially Gary and Yvonne, who are providing lots of technical support to us. The pictures here showing our team getting an award from the EdTech Asia in 2019 for applying 3D and VR technology into our academic programs. And finally, the Dean of our school, Professor Linda Lee, and our Finding Dean, Professor Joseph Lee. Without their support and encouragements, all these projects cannot be success. I hope you will enjoy my talk today. Thank you.